Hi guys, welcome back. I'm so happy to be here again. Um, I planned this week. I will do the session on how we can identify. Okay, I have depression, and then the plans for that, and how to identify the symptoms, and then what you have to do, and the plan and. The options you can choose but mm, in one stretch, um, sharing all that will be exhausting, so I decided to divide different topics, different part of it in each week, and then finally I'll um, do the conclusion, like I can repeat like the main steps, and so this week I would like to talk about um, the scientific aspects, and so far I didn't use any technical terms because I was talking from the the philosophical aspects, the psychological aspects, uh, and more of the spiritual aspects, and then the logical aspect, the science and neuroscience. But I didn't use any terms because it will complicate, and I would like to reach out to even a common man. You know, I want to use simplest words so everyone can understand. So this week I would like to use some scientific terms. What happens in like the brain, the which part of brain is responsible for the emotion, and especially the extreme emotions like fear, anxiety, threat, and the part which is involved with the depression. And um, like uh, we'll start that aspect here. So um, the emotions, the fear, and the threats, and the decision making in this kind of extreme situations are done by a part of brain at the center called amygdala. Okay, so this part, amygdala, is responsible for these emotions, and and the decision making is done there. How how it works, or what happens in extreme conditions, you know how amygdala works is, when you are in fear, you know so I would like to explain what is fear, or I would like to define what is fear, based on the concepts we discuss, like mind, how the perceptions, and the outside interactions, and how the mind works, the thought process and intelligence. Based on that, how we will try to define what is fear. Okay, so um, according to the terms, what we discussed so far, fear is a gap. It's a gap, or the time uh, taken by the brain to figure out what is happening. Okay, so our intelligence and thought process and the memory, the coordination, and the figuring out and the decision making is not happening there, because something unfamiliar is happening there, or something unexpected is happening there. Okay, so the brain will take time to figure out what actually happened. So that is called fear. So that is a definition of fear. Okay, so it is the time taken by the brain to figure out what happened. Okay, so before going to depression, the reason for depression is actually fear. Fear means, so we can say fear means ignorance. We don't know. A stage of ignorance. A state of ignorance. So when this fear comes, and perceived, then uh, then the situation, how this amygdala reacts is, there's a term called amygdala hijack. So it's extreme fear or panic attack, or that kind of situation, this amygdala hijack happens. That means amygdala shut down, and only basic reactions will be sustained. That means only the instincts. There won't be any logic or thought, or responding to your senses, nothing. Just the instincts. No analyzing, no assessment, no decision making. Okay, so this is amygdala hijack, and it is the shutdown of all the emotions and feelings and everything. And it is continued, the response is continued based on just the instincts. So actually, before depression, this we face this stage. So amygdala shut down. Okay, so after that, if we don't realize we are under depression, and we don't start figuring this out and reaching out, or reaching out to a counselor, or expert psychologist or therapist, this is, you will go continue in this state until it is resolved. So as I said, our brain has the capacity to adapt. It is flexible. How we can take out, how we can come out of our trauma and all those stuff. So here, if we don't work out on this, brain is practicing, brain is fixed on this, and if it is continued as such, then it will develop a pathway, and your response system will be wired in that manner, in that pathway. What is going on, shut down, and only the instincts, you will go like that until it is resolved. And again, the long how long it is not resolved, as I said, 21 days is a time for the brain to uh, pick up a new habit, or pick up something new, and uh, then it will become a habit. So the same way, a strong pathway is formed, and your brain will work only in that way, and it will be continued long time. you know some people suffer chronic depression, like years and years of depression, and it is hard to treat. They are treatment resistant. So this is what is happening there, because a strong pathway is developed. And so the pathway means, the neurons are conditioned in that way to respond, and it is fixed, permanent. So this kind of stage, the treatment resistant depression is treated by the electric ECT, electric convulsive therapy. Yeah, the electric shock is given, and that is so that is the efficient, that is proved to be clinically efficient treatment for the chronic depression patients. What I would like to say is, so this, see, our brain has the flexibility. We have the flexibility to come out of the trauma and live in the trauma. Okay, so it is your choice. It is your choice what you want. So the term, the flexibility of brain, to adapt to any kind of situation. Okay, any kind of situation, that is called neuroplasticity. This neuroplasticity allows us to adapt to any kind of situation. The brain is flexible. Okay, so it has benefits as well as, these are the cons of pros and cons. There is pros and cons of this neuroplasticity. So this so we discussed about the terms and what happens, and so far so why next we have to think about why we have to reach out. Why we have to reach out immediately, like when you realize, okay, this is happening to me, or something is happening to me, and I can't sense anything, I can't enjoy anything, I don't feel happy anymore. Then you have to reach out, and you at least reach out to your GP, or or find a therapist, expert in who are expert in depression treatment. Okay, so what is the significance of that? When, while we are going through this, as I said, our brain lost the trust in the system. Okay, so it completely shut down. So, and we are questioning inside, we are questioning ourselves. We are not enough, you are not enough to sustain here, we are questioning. So when we reach out, the therapist or the counselor or the psychologist can give the light or the knowledge that, what happened, what happened there, and what was your fear, and why it was your fear, and how you can come out of this, and they will validate your emotions. That is very important. We need that validation at that point. Someone is telling, yes, you are right, or what you are feeling is right, and it is normal, and you have all the right, all the freedom to feel this way. It's the validation. So it is very important that time to convince the brain, yes, what you did is right, or what you are feeling is right, and you have all the right to go this way. So hope this session help you. Thanks for watching, and we will catch up next week.